Fatalities. End AIDS. End pandemics. World AIDS Day.
As the world marks World AIDS Day, in Cape Town, all eligible persons with immuno-compromised medical conditions such as HIV will be able to receive an additional dose of the COVID-19 vaccine at sites after they have registered on the Electronic Vaccination Data System. The event is organized by the local community organization Touching Nations and aims to promote health and wellness through the means of dialogue, engagement and provision of material covering HIV, TB and COVID-19. Mariska Botha is at the event.
We're coming to you from Belhar in Cape Town, where there's a one-stop shop, as you will, if you will, that has been set up here, where people are getting their vaccinations today, but more importantly, people are getting tested for HIV as well. Privacy tents have been set up. People fill out forms, they go in, they get their HIV tests, and that's the purpose of this day, to spread the message about HIV and services resuming again, and people really tackling the issue of HIV. South Africa remains one of the countries in the world with the highest number of HIV infections. So it remains a critical point within the healthcare system to, first of all, find those people who are HIV positive and then work out a treatment plan for them. We had a lovely conversation a little while earlier with an HIV expert. He's Dr. Neelis Grobbelaar, and he's with the Anova Health NGO that works with people that have HIV and helps them to manage their condition. And he told us that COVID-19 did throw a spanner in the works. It was very difficult because clinics had to close, people couldn't get to their treatments, they couldn't get their medicine. But of course, as he said in his words, South Africans are innovative, and plans were made, and new ways of delivering medicine to people were developed. And he said what was seen, which is very positive and encouraging, is that people were taking control of their own condition and making sure that they get their medicine and they get it on time to keep healthy. What he's also told us, it's the 34th year since the first World HIV AIDS Day, and he says since then the world has come a long, long way. He says testing positive for HIV is not a death sentence. Back then, over 30 years ago, people had a very short lifespan, but he says now if people take their ARVs and they live a healthy lifestyle, there's no reason why they cannot live very long and productive lives. He also gave us some statistics about the Cape Town Metro, saying there's around 350,000 people within the Cape Town Metro that are HIV positive. Now, what's interesting about that is that around 220,000 of those people are actively taking their medication, using their medication and following a treatment program. But what's concerning is that there's 22,000 people who are infected. That's the estimates according to modeling, that are infected, that have not come forward and not have been tested, and don't know that they have HIV. And then there's another over 40,000 people that do know their status, but they're not in treatment. And then there's also a group of people who are in treatment, and when they feel better, they leave their treatment. And he says the idea is to ensure that people come forward, get tested, get onto a treatment plan and remain on a treatment plan. He says South Africa is a country where people tackle the big things, and what was learned during COVID-19 is also being used in the fight against HIV/AIDS. Again, encouraging people to come forward, get tested, and if needs be, come onto a treatment program and remain on it. People are also getting their COVID-19 jabs here today. People are also being tested for high blood pressure and the like. So the Western Cape government really trying to spread the message that services have resumed despite of COVID-19. Get back on track, get back into treatment if you fell out of treatment, and asking people to come forward, get tested and get onto a treatment plan. As Dr. Grobbelaar said, there's no reason why people cannot live a long and productive life if they remain on a treatment plan and look after themselves.
Thanks, Mariska.